Hi, welcome to my presentation about the human immunity. So here, within this section, we're going to understand the non-specific defences, such as the first and second line of the defence. Firstly, I wanted to talk about what an infection is. So an infection is classed as an invasion of the body by microorganisms, such as bacteria and viruses. The microorganisms use the person's body to sustain itself and reproduce. It will normally be in the area in which it's entered. So the pathogens, the four main causes of infections are parasites, bacteria, fungi and virus. So the method of transmission. So the method of transmission is a process by which the pathogens spread from one host to another. It will go either indirect, direct or vector. This, for example, in the indirect, it's person to person. The direct transmission is airborne, and vector is like an insect bite. So the two lines of non-specific are the first line of defence and the second line of defence. So here I will show you what the first line of defence does for the body. So the first line of defence is that our bodies are constantly defending against attack from pathogens. So the first line of defence starts from the structure of the skin. The structure of the skin forms a system, and it has three important layers, which are the epidermis, dermis and subcutis. These will all act as barriers to prevent any pathogens from entering the body. The skin will form a physical barrier and will immediately start to heal itself from pathogens. It will do this by immediately forming like a scab over your skin. So here I've done, I got a picture of the first line of defence. So it's your saliva, your tears, and your skin, your stomach acid. These will all act as like first, so if it's entered within your body, so the stomach acid will be your first line to protect it from any pathogens. So the second line of defence will take action when the first line of defence has actually failed. It will involve structure of the body and the cells that produce to act against antigens. The second line of defence is a group of cells called tissues, organs, which will all work together to protect the body. The body reacts in a number of ways. If this is the next stage, it will either become inflamed, you will get a fever. These are all like the second line of defence kind of sort of symptoms. So the skin barrier. The skin is one of the largest organs that will protect us from any pathogens. The skin will form a watery barrier and defend itself from any infection and any chemicals that actually come in. The skin barrier is very important to the human sort of body structure. Physically, it will protect from any infectious agents, chemicals or toxins. As long as the skin is not broken, then it will be the first line of defence for any pathogen. The skin forms part of a system called integumentary system, and has the epidermis and dermis layers. They will all act as the first line of defence. The macrophages are very important components of the immune system. Their role is to form a response to any infection that enters the body by destroying them. Macrophages are produced through different monocytes, and in turn, when leaving the body, will become macrophages. So inflammation of the skin. The inflammation of the skin is a sign of the immune system's response to an invasion. Inflammation is caused when trauma has occurred to the skin surface. So the primary response is for the skin to increase its blood flow to affected areas, and the blood vessels around the area will dilate so that the blood can flow freely to the affected areas. Cells around the affected areas will form gaps, allowing the immune system cells to go through. The tissues of the affected area can become red and also swollen and sometimes painful. So in this second section, we will understand about specific immunity. So a specific immunity can be classed as an acquired immunity. It is not inherited at birth, but acquired over time due to the exposure of pathogens. Acquired immunity can be categorised as natural or artificial. Natural immunity is required by everyday encounter and exposure to the disease, causing antigens and pathogens to form naturally. Artificial immunity is when we've been given a vaccine which will help to destroy the disease from sort of getting worse with it, producing any more pathogens. The third line of defence. The third line of defence will involve cells and chemicals that will act specifically as antigens against them. Cells will actively work against the foreign organisms that have entered the body and imitate a response to them. So they sort of like, they become very similar, so they can fight off. The required immune system in the human body will respond for the destruction of any pathogens that it doesn't know about. It will first learn how to attack and destroy any pathogen, which will result in the immune system not being infected by the infection and create an acquired immunity. The cells that are acquired in the immune systems are the B cell and the T cell. So acquired immunity comes from the vaccines. The learning process starts when a person encounters foreign invasion and the body does not recognise it. It will start to attack the components and will learn the best way to attack each antigen. Our immune system will include like the cough reflex and the stomach acid and skin, and these will all act as barriers. However, after the antigens will also remember the actual pathogens that have been in. So if you get the same disease, it's likely that you won't actually get it as bad as you had it before, or in some cases you won't actually get it at all. The cells that play a specialised role in adapting to the immune system are all these. These are all very important, and they're all found within the blood, within your blood. So the white blood cells are also very important. They are not a single cell, but are categorised into 5 different types of leukocytes, which is produced in bone marrow. So these are all the main important ones. The immunoglobules are plasma cells that make up the immunoglobules, which are also known as antibodies. If you have an infection, it will make in your bone marrow makes more plasma cells and immunoglobules. They travel through the blood and help to fight viruses or bacteria within the body. So these are the main important 5 immunoglobules. So your body can sometimes become hypersensitive to a pathogen, or a disease. Normally the immune system plays an important role in protecting the body from microorganisms and other foreign substance. If the activity of the immune system is either excessive or overreacted, a hypersensitive reaction will occur. This will make your body hypersensitive to the actual pathogen, and maybe injure a certain area of your body. Hypersensitive disease have been grouped into 4 categories: immediate antibody mediate, immune complex mediate, and cell mediate. So self-recognition and tolerance to our own tissues. Self and tolerance is the ability of the immune system to recognise antigens as being non-threatening, but also responsible for foreign substances. This will balance an immunology defence and create a self-tolerance. The body will not normally attack the body's own cells and tissues, but in some cases when tolerance is lost, and it will bring like a disorder. So rejection of transplants. When a person receives another person's organ, this is due to them having a disease that needs an organ. The person's immune system will sort of recognise it as a foreign body. This is because the person's immune system detects that the antigens of the cells are different and they don't match. There are 3 types of rejections. These are hyperacute rejection, acute rejection, and chronic rejection. To help the person who is receiving the organ, will need like to have tissue types, and it will also need drugs to add it as though it's the same sort of organ coming from the person who it's coming from is the same person. So here is an immune system disorder. This immune system disorder is rheumatoid arthritis. Rheumatoid arthritis, it sort of affects the feet, wrists, and hands, and it can make your hands swell and stiffen, and can be very, very painful. The immune system that normally fights off infection will attack the cells that are lining with the joints by mistake, making them swollen. People can live for a long time with rheumatoid arthritis, but it can be very, very painful. So the multiple sclerosis, this is where the immune system will normally protect us from harmful substances from entering the body. In this case, it's the immune system has sort of malfunctioned, and it's attacking the nervous system like healthy tissues. The immune system disease can cause many problems, such as muscle problems, bladder dysfunction, impairment, and an abnormal sensitivity. So in the next section, we are going to understand the biology of vaccinations. So vaccinations involve exposing the body's immune system to be weakened. It does this by stimulating white blood cells so that they will produce antibodies within the immune system. Vaccinations can contain live pathogens, which are not harmful to the body, but when a vaccine is injected into the body, it will stimulate the white blood cells that will produce the antibodies to fight against the pathogens. This is what has happened within the COVID. So it's obviously fighting against COVID, which is a really good uptake and understanding of like the vaccinations. So vaccination exposure is where there's a primary response and a secondary response. So it will obviously, vaccinating will help the person to not develop the disease, but help them to be immune from the disease. The primary response is when the pathogens will firstly enter the body and try to attack. It will take time to identify the pathogens, and within that time, it's obviously the pathogens have multiplied and gone further. So that's why the first line of defense response, is the actual body understanding the disease in which that's come in. The secondary response is normally that they've had the exposure to, so that the white blood cells can obviously reproduce a lot quicker because they've had that, they've had the pathogens in the body there before, so can fight it off straight away. So there's within acquired immunity, there's natural acquired immunity and artificial. Natural acquired immunity is exposed, like what we said, to the live pathogens, and develops a disease and develops immunity. The T cells within our bloodstreams will attack the pathogens that then present the pathogens to the B cells. Artificial induced immunity is when a person can build the resistance to the disease following immunisation that will protect them from the disease in the form of a vaccination. So here I wanted to talk about the measles infections rate. This is a good sort of example of what's happened, having a vaccination will help to reduce a lot of diseases within the country. Measles, it's obviously, you can see from 1940 to the present of how different it actually is, like with them having the MMR vaccination. So herd immunity this is when with us all having the vaccinations, that is why we are big this year on, like, obviously this last 2 years on the COVID, because it shows you that it will, by just everybody being immune to one disease, will stop the spread. The benefits, so the benefits of vaccinations, that it prevents diseases, it will keep people healthy and it'll keep people safe. The effect, so due to the interaction of people making greater effort to protect ourselves from spread of the diseases, that's why it's vitally important for us to actually have the vaccinations. The recent vaccination programme of COVID-19 has been widely recognised for reducing the numbers of COVID-related infections. Thank you very much for watching my presentation on human immunity. I hope you've got a lot out of it. Thank you.